Introducing gambling disorder. Gambling disorder describes a condition in which there is distress and negative consequences associated with someone's problematic gambling. Over the course of a calendar year, someone may experience some of these symptoms as it relates to their gambling use to meet the criteria for gambling disorder. For example, someone may increase the amount of money that they're gambling to feel some sort of rush or intense experience related to gambling. What's really fascinating about this is that if you've seen some of my previous videos, I've discussed substance use disorders, and tolerance is one of the symptoms that I've mentioned for substance use disorders. It's wanting to ingest more of that substance to achieve the desired effect that someone is looking for. Similarly, with gambling disorder, someone may increase the amount of money that they're gambling with or increase the amount of risk that they're experiencing with their gambling to feel some sort of rush or intense feeling. This is really interesting when you think about the concept of tolerance as it relates to substances, and then also how this specific symptom may experience and express itself amongst individuals with gambling disorder. Someone may become anxious, angry, or on edge as they try to cut down or stop gambling. And related to this, they may have multiple times where they have tried to stop or multiple times where they have tried to cut down and found that they were unsuccessful in doing so. They may spend much of their time thinking about gambling, planning the next gambling event, or planning some sort of risk activities related to gambling. So a lot of their time may be focused on that to the point that many of their thoughts are consumed by gambling and it becomes part of their identity. Some individuals may decide to gamble as a way to cope with negative states or emotions that they're experiencing, but this is definitely one of those potentially harmful and negative ways of coping with other events going on in someone's life. They may perform this activity called chasing their losses or loss chasing, essentially where they're trying to win back the money or items that they've lost previously, whether it's the very next day or a couple days later, basically trying to win back and recover from the losses that they've already achieved through their gambling. They may downplay or minimize or completely conceal how much they are indeed gambling from others in their lives, loved ones, coworkers, friends, you name it. So basically just reducing the perception of the amount of times that they are indeed gambling, or basically saying that they're not gambling at all. This could be done because they may feel shame, or they may be embarrassed by the fact that they know what their loved one or family member or friend may say if they find out how much they are indeed gambling. And to that end, relationships, occupational opportunities, educational opportunities, or other major aspects in their lives may have been severely damaged or completely deteriorated as it relates to their gambling. And they may find themselves in a difficult financial state, basically being underwater. As you can see, this amazing background, they may find themselves underwater financially as it relates to their gambling activities, which may result in them having to rely on other people or other loved ones or people in their lives, relying on them, asking them for money as they try to cope with the fact that they've lost so much financially and that their gambling behavior has indeed impacted their finances. Or in some instances, they may use the money that was provided to them by these family members, loved ones, and friends to gamble again. Now that I've introduced gambling disorder, and when you look at some of my previous videos where I talked about substance use disorders, what are some commonalities or differences that you can think of that come to mind when you think about gambling disorder and substance use disorders? So feel free to leave a comment just telling me what you think are some commonalities and some differences. So with that, in the very next video, I will discuss how many adults in the United States actually have a mental health disorder. Thank you so much for watching, and I hope to see you on the next one. Thank you.